And the Department of Health says around 80,000 Pfizer vaccine doses are to be disposed of at the end of March once they reach their expiration date. The department has raised concerns about the low numbers of people who show up for vaccinations. We're joined now to explore the significance of this development by UKZN Research and Innovation Vice-Chancellor, Professor Mosa Moshabela. Thank you very much for availing yourself this afternoon. Does this come as a surprise given the amount of resistance when it comes to vaccination in the country?
Yeah, good afternoon to you and to the viewers. Indeed, it does not come as a surprise. In fact, I think that from my own perspective, we expected to see this sooner. The fact that we are only seeing it now is to some extent credit to the people who have been managing the stock of vaccinations. But it is nevertheless very disappointing to see about 80,000 vaccine doses being destroyed when actually there's still a lot of people who need the vaccines, not only in South Africa, but in many parts of Africa as a whole. So it is in itself a statement and an indictment that is actually quite disappointing.
A number of countries also, I think it was Nigeria and Malawi, I do stand to be corrected on that, they also had to burn some vaccine doses because of the low levels of vaccinating. In retrospect, at least, does it appear that perhaps in this scramble for vaccines, especially given that the continent was the last to receive, we may have procured more than what we needed? We just take a look at the mortality rates on the continent, the number of people who are infected. We're nowhere near what we are seeing in Europe, for instance.
Yeah, no, I think that you're absolutely right that a large part of it is about supply chain management, and we've seen it in other places. In fact, even in South Africa, we didn't destroy doses before, but we have had what we call wastage, about 400,000 doses, an equivalent of that, which is about 1.45% of all the doses that we have received has gone to wastage, because sometimes when we draw out the vaccine, we don't use the full vial. Sometimes the vial is open towards the end of the day and it cannot be used the next day. So they had to throw that away. But I think having said that, it is important to emphasize that South Africa, in terms of what has been possible, we have procured enough doses that we need for everyone to be vaccinated. It's so sad. It would have been so sad if a lot of people wanted vaccines, but they could not access them. The fact that they are available is actually a good thing. What we are faced with is exactly as you said, is that the anti-vaccine messages and a lot of misinformation that has taken a toll in South Africa during the vaccination rollout has actually done a lot more harm. And I don't think that we've done enough as a country to combat those anti-vaccine sentiments.
And how do we imagine to do that, Prof? And I ask maybe because both the health minister and the president noted that our biggest drawback is the 18 to 34-year age cohort with 34% coverage. What do you tell these young people who are very big on choice, who are very big on doing their own research and making their own decisions?
Yeah, it's also the same age group that also gets a lot of information and messages online, and a lot of anti-vax messages are distributed online on Twitter, Facebook, and so forth. And that's also why they are unlikely to vaccinate. Actually, from my side, I actually expected better from that group, because I thought that they would be more equipped to critique information that they encounter online. But sadly, that was not the case. And I do think that at the beginning of the pandemic, during the first lockdown, I remember that government actually instituted a law that made it criminal to actually send incorrect information. And there were people who were actually arrested for spreading misinformation. And I feel like during a public health emergency, it's important that we put those measures in place, because they put people's lives at risk. Yes, you want to make sure that there is choice, people can have free access to information, but misinformation is just as dangerous as someone, indirectly causing harm towards somebody else. I think that we did not do enough in that regard. It's a little bit late now that the sort of state of disaster is coming to an end and we are coming more into routine services. So I don't expect at this point there's a lot we can do. It's unfortunate that many of the people that are not going to get the vaccine will also be people who are of lower socioeconomic status. So those who can afford and who will be vaccinated will be protected, and those of lower socioeconomic status will suffer most. That's the unfortunate reality.
As the state of disaster may come to an end, do you perceive a parting shot here in the form of a vaccine mandate for the country more broadly? We saw the president giving amendments to some of the lockdown regulations, including when you come into the country, you must either be vaccinated or have a negative PCR test. To go into public spaces, you must either be vaccinated or have a negative PCR test.
I think that the vaccine mandates are important for the workplaces, and I think that they're important for places of gathering like churches, places like schools and higher learning institutions, and also for events. And we can also add perhaps screening tests, including rapid tests. And I think that we should also make home testing available. During the surge of infection, then we can have a little bit more stricter measures around managing cases and infections. But for vaccination, I think that in those places that I've listed, that would be the areas where I would pay more attention to in terms of vaccine mandates, not necessarily impose mandates on the general population who at times may have other social and economic barriers that we have not addressed in order to accommodate their needs.
Thank you very much for availing yourself this afternoon. UKZN's Research and Innovation Vice-Chancellor, Professor Mosa Moshabela.